Hi, this is Rick Frederick with a review of London, Bruck, Wright, Ceci, and Ceci, 2008. Review of the contemporary literature on how children report sexual abuse to others, findings, methodological issues, and implications for forensic interviewers. This is essentially a review paper trying to get some information from a review of published work about rates of disclosures, delay in disclosures, recantation, so forth. The reason they're interested in this is because there's essentially a view that children need to be interviewed in certain ways to get information out of them that in which there's a good suspicion that they have been sexually abused. Of course, the problem with this is that the interviewing process itself, especially suggestible or repeated interviews, stuff like that, can create memories that are not accurate. So the paper is really designed to evaluate questions of, is this a reasonable concept that interviewing needs to take place, or else we would not learn about sexual abuse that has occurred. Their conclusions were that children do often delay abuse disclosures, but that when children have been abused, it's not common for them to deny it or to recant it during a forensic evaluation. So, the start of the paper is really about issues with trying to make sense of information that may be vague, suggesting that maybe abuse has occurred. And the problem is that leads to many false positives. I can't really distinguish false positives from true positives based on symptom patterns or vague evidence. Many behaviors that result from abuse are also present in many non-abused children. And this is the big mistake of the past 40 years of child abuse investigations, is a rigorous response to symptoms or indicators without a recognition that many of those are false positive indicators. They occur, they're distributed among abuse victims and non-abuse victims. Medical findings are often inconclusive. Child statements are not great validity without support from physical evidence. So it's all understandable that in the urge to protect children that you engage in techniques that bring forth statements, but those techniques are often suggestive and risk eliciting false disclosures and creating false memories. There's an idea of looking at symptom patterns in the child sexual abuse accommodation syndrome. Again, this is there's really no support for this scientifically. It is a anecdotal idea that does not enjoy scientific support. So what they did is look through 13 studies, and for people who reported unwanted sexual experiences, and most adults reported that they had delayed disclosure or didn't even disclose it to anybody during childhood. Maybe one half to two-thirds of adults never told anyone at all in childhood about sexual abuse that was occurring. And maybe as few as 10% reported sexual abuse to the authorities. There is often a considerable time lag between abuse and disclosure. And then if in a formal interview, rates of disclosure were as low as 1/4 all the way up to everyone. Rates of delay of disclosure increase as a function of age. And why do younger children not report sexual abuse? May simply be a cognitive problem. including not recognizing that there's something inappropriate going on. What else is determinative of lower disclosure rates? Closer relationships with the abuser. The overall pattern is that many children simply do not willingly tell. And so this does give rise to a need for investigation. And of course, what should follow is an investigation that's based on sound principles that reduces the probability of eliciting false details or interrupting or recreating memories such that false memories are created. Among sexually abused children undergoing forensic interviews in a standard tell me what happened style, a majority will provide details, and even with repeated interviews, they will provide abuse-consistent details that make sense and will not recant. A survey article, well worth reading. Thank you.